we don't know what the long-term side effects of vaccines are. What can you help us with on that one?
That is a great question. And even the scientific and medical community want answers to that. So where do you see precedence is all of the vaccines that have come before the COVID-19 vaccine. So what are the long-term side effects of those vaccines? And if you look at them, it's few and far between. So I'll give you some examples. Let's take the polio vaccine, for instance. And there are two types of polio vaccines. You have the shot that you give, which is what we give in this country. It's an inactivated vaccine. And then you have the live oral polio vaccine, which I grew up in India. That's the oral polio vaccine that I had. So in a certain percent of those vaccinees, the vaccine would undergo reversion and become the virus, and then go on to cause polio, paralytic polio. Now, that is an extreme case. That cannot ever happen in our case because the virus just isn't there. So the three vaccines that we have the EUA for in our country, two of them are mRNA vaccines. What does that mean? It means I don't know what the biology background of our student athletes is, but we have our genetic code. Our genetic code will give a string of nucleotides, which is the messenger RNA, which gives some message to the ribosomes to create a string of amino acids that creates a functional protein. So these mRNA vaccines only have the message to make the spike protein for that virus, for the coronavirus, the SARS-CoV-2. So that is not going to happen. It will not give you COVID-19 disease. It will not give you a manifestation of that disease with the mRNA vaccines or the adenovirus vaccine, which is the Johnson & Johnson vaccine. Now, the technology, the mRNA technology is new. But if you look at the numbers of individuals who have already been vaccinated against this and whom we've had the opportunity to follow for any adverse reactions, side effects, etc., we have had the opportunity to observe millions of individuals who've received the Pfizer vaccine as well as the Moderna vaccine. Any side effects that you see is a result of the vaccine, and that is different from what we consider to be the long-term effects. So side effects may be pain at the site of injection, it may be headache, it may be fever. After my second dose of Pfizer, I had fever. After my first dose, I had arm pain. That's about it. And then you recover. So that's a good sign. That's your immune system telling you that I've seen this virus as foreign and I have reacted with appropriate immune cells. So long-term effects, if there were any, we would have had the indication that the vaccine is causing that. So all of you young people who are only now maybe getting to the EUA and being able to get vaccinated, you've had the benefit of the rest of us getting vaccinated, and there hasn't been. So every vaccine scientist will tell you they're kind of nervous until the first 1 million or 2 doses have been administered. So we have had remarkable good fortune with these vaccines.